but we're really, really happy that you guys are here. So thank you for taking the time out of your busy days. Did you want to say something?
A specific thank you to Dr. Clinvard for hosting so many of our students here from our program.
Yay.
You're welcome. They've all done well.
They're clapping for you.
Yes. That has been an amazing addition to our program for so many of our students to get to work with animals. I'm sure you'll share, what you do, but you've given our kids so many amazing experiences, like surgery, like watching surgeries and things like that they would never be able to do with humans. So
Yeah. No, that's great. We like having interns here, and they've all done a good job.
thank you.
Thank you.
So maybe we could start out, if each of you guys could introduce yourselves, and you could share what you do and what drew you into your respective fields. Maybe we could start with Dr. Clinvard.
Okay. Paul Clinvard. I was a 98 OHS grad. I went to University of Vermont and then Ross University in Cornell for veterinary school. I've always been interested in medicine. My father was a pediatrician, but he told me not to go into human medicine. So here we are. But actually started with animal medicine when I was about 8. My cat was diabetic. That's when I started giving insulin injections and caring for him then. I worked in the early 90s down at Choice Pets, down in Arcadian, which unfortunately isn't there anymore. And that's when I really started the hands-on stuff. Worked through college at animal hospitals, and we'll probably talk about that later, but I think anyone who's interested in veterinary medicine should really get somewhere for intern stuff, make sure you work as an assistant, make sure you're actually in the field a lot, make sure it's something you want to do before you spend 9 years preparing to get into this field. I've been working about 15 years as a veterinarian, 2 hospitals previously, and then about 7-8 years ago we opened family veterinary care here on North Island. And I do general practice. I do preventive care, I do medicine, dermatology, surgery. I kind of stay away from orthopedics, but soft tissue surgery, and basically everything. It's one of the good things about veterinary medicine is we can do full practice. We can do absolutely anything we feel comfortable with within the field. And there are plenty of specialties that you can do if you want, but I like general practice where I can kind of dip my toe anywhere.
Fantastic. Thank you so much.
Okay.
Should we go to Janae? It's so great to see you.
Hi, Dr. Cohen. My name is Janae Morgan. I graduated from OHS in 2011. I'm a registered nurse. I guess I'll talk about where I went to school. I went to school at Fairleigh Dickinson University in New Jersey. My choice to go there was solely finance. They gave me the most in scholarships, so I had to go where the money was. After graduating in 2015 with my bachelor's, I started at Northern Westchester Hospital up in Mount Kisco. Started as a new grad nurse on a cardiac floor. I worked the night shift for 3 years. And then there was some turnover in leadership. The assistant manager at the time, who was being promoted to the nurse manager, kept harassing me, I jokingly say, for me to be his assistant. I said, no. And then I kind of took a leap of faith, and I was the assistant nurse manager up until April 7th of this month. I graduated with my master's as a clinical nurse specialist in the beginning of this year from Hunter College. And I accepted a job offer at Sentara Heart Hospital down in Norfolk, Virginia. So I'm in the process of moving. And I'll talk a little more later on about what a clinical nurse specialist is, but in general, it's like a hybrid mix of a nurse practitioner and like a super educator. So that's where I am now.
Fabulous. Thank you. And we could go to Joey. And Joey's at OVAC.
Yeah,
OVAC. We love OVAC. So thanks for everything OVAC has done for us.
Yep. Hi, how are you guys? I'm Joey. I am a 2013 graduate from OHS. I am a paramedic, both in New York State. I'm also nationally registered. Up until recently, I worked full time at OVAC. I just accepted a position as a community paramedic in a little town in Colorado. A lot of new stuff going on. I went to school at WCC as well as Mercy College. When I became certified, it was initially as an EMT, and I worked in a private company called Empress in Yonkers, and their call volume was through the roof. You know, we did a lot of stuff, a lot of quick stuff. So I got the opportunity to learn a lot before joining the crew over at OVAC, and we got to do so much cool stuff at OVAC and stuff that I'll talk about a little bit later. And yeah, I'm excited to be here.
Thank you so much.
Thank you.
And finally, we have Shada, and your brother is sitting here, by the way.
I promised him I wouldn't embarrass him, so I'll try to be cool. I'm Shada, so I was also class of 2013. I went to University of Pennsylvania for college, and I went to NYU for dental school, which I just graduated from last May. And I'm currently in residency, which will be ending in a few months, and I'll start looking for my first official job as a 26-year-old. So I feel like I'm a little late to the game, but I love dentistry. I always knew that I wanted to go into healthcare, especially in high school. I kind of like had a gravity toward dentistry because my mom was a dentist back in Iran, and we have a lot of dentists in the family. So when I was in science research with Pick and Holmes, I did some like dental related projects. I assisted at Open Door right across the street while I was in college. So I kind of knew I wanted to go into it from a young age, but I think it's a great career. I personally like it because I always was interested in art and kind of working with my hands. I played the piano when I was younger, and I took AP art when I was at OHS. So I think dentistry is great for someone who likes working with their hands and, you know, wants to go into a medical career, but wants something a little bit more technique sensitive or technique specific than being a medical doctor. Nothing wrong with being a medical doctor, of course, a lot of respect to them, but I think it's a very unique career, and I'm happy to talk about it today.
Fabulous. Thank you. Thank you so much. Do you, we have a lot of questions from our students, and we want to sort of put the focus on our students, but before we switch to them, could you guys each talk about first, like how you felt Austin High School prepared you for your future career? And then if you haven't already said, like what specifically drew you to this career in medicine? We could start with Paul again. We'll just keep going around. Oh,
okay. So, you know, I really learned to study, actually, I would say chemistry was really where I first learned to study at OHS. You know, before that, I didn't really have to do it that much. But you know, once we got there, really learning to study, learning how to organize was helpful for the future career. And, you know, the truth is there's so much learning even after high school to start in a medical field. So it's really just the background, learning basic sciences, learning how to talk to people, and social aspects of high school was certainly helpful. I'm just trying to think, you know, the English and those, learning how to write, learning how to express yourself, which I'm having difficulty doing currently, is certainly helpful. And surprisingly, math a lot. I mean, pharmacology, I had to teach other veterinary students how to figure out dosage, flow rates, this kind of stuff, which really I actually made a lot of money tutoring during vet school doing. So I'd say you really need a really broad background that does start in high school before you get to college. And I thought I was well prepared for the next step after leaving OHS.
Hold up the side, or just say it.
and what drew you to being a vet?
Oh, yeah, sorry about that part. I was always interested in medicine. My uncle and my father physicians. My mother's a psychologist. It was something I was always interested in. I like animals, and I feel like they're, you know, less gross than people. So I figured it was a good thing to work with. I grew up with cats. All my friends had dogs. I spent a lot of time working with other animals, and I just figured it would be an interesting career. I could, my patients were those that I enjoyed being with, and it's something that I probably wouldn't get bored with, which I haven't at this point.
Awesome. Thank you, Janae. And Janae, we have a lot of students interested in nursing here. So
Nursing is rough. I'll start with that. So I think Ossining High School prepared me very well for my career. I always knew I wanted to be in healthcare, but I didn't know I wanted to be a nurse until about my sophomore year of high school. I went to California for this like youth leadership forum on medicine. And honestly, the doctors were saying that they're like $400,000 in the hole. They had to go to school for 12 years. And respectfully, I just felt like that wasn't for me. I knew I wanted to care for people, but I didn't want to be a doctor. And that's okay. I always knew I wanted to be a nurse. Recently, my mom actually showed me a picture that I drew in kindergarten when they asked you, like, what do you want to be when you grow up? I wanted to be a NICU nurse. I don't really care to work with children. But yeah, I've always known I wanted to be a nurse. So as a result of that, I don't know, is Miss Griffin still there, the guidance counselor? She's a gem. So I sat down with her and I told her like what I wanted to do in my life. So she recommended that I take anatomy and physiology. That class was so helpful. When I went to undergrad, there were many students who never took A&P before, so they were struggling. And I'm just coasting through because I'm like, oh, I've seen this before. And then on my summers off, I used to work as a pharmacy technician down at Hudson Pharmacy. So that certainly helped with pharmacology. So yeah, I always knew I wanted to go into healthcare. And I mean, I certainly didn't think I'd be working through a pandemic. But nonetheless, it's a rewarding field. It's tough. But it is a very rewarding field. And I really think that Ossining High School prepared me.
thank you so much. Joey?
So the biggest thing that I took away from the high school was that it's okay to like change your mind, because I originally left high school pursuing an architecture degree and I got into it. It wasn't it for me. I tried moving over to criminal justice. It just wasn't it. And then I ended up finding our branch of medicine that is EMS. And it was really nice to like still feel comfortable, because I had been taught that like it's okay to change your mind and be uncomfortable for a little bit to find what you really want to do, because that's what you're going to be doing for a long time. And classes that I got to take, all like the science-based classes, I took a bunch with Mr. Yonkler, Mr. Albrecht. We got a bunch of cool different ways to think that do help in the medical field. It might be completely unrelated, like an engineering class, but getting your mind in an environment where you have to think differently, it helps out a lot in the back of an ambulance when you're driving down the road, because you got to think outside the box. EMS, when I found it, it was just something that, Mr. Olson had a big impact on my career in high school. And a little known fact, he was a volunteer EMT back where he lived. And it was cool to be able to honor him and follow in his footsteps. That meant a lot for me, because he did do a lot for me. And just pursuing it, once you get into like that little bit of EMS, being an EMT, you're pretty limited on what you can do. And then furthering education to being a paramedic, you can do so much more. And that's just something that I look forward to pursuing. And I'll talk about it if we get a chance, but the field of EMS is changing so much now. It's a very cool thing to be a part of.
Fabulous. Thank you. Shada?
So I think my decision to go into dentistry kind of started from my passion in science, which really didn't start until I took anatomy and physiology with Mrs. Strada and AP Bio with Mr. Straub. I think those were two of like the really important classes that I took in high school. Because up until that point, I was always interested in science, but taking those classes gave me a real appreciation of biology and the human body, and kind of helped me start understanding the world in a different way. And that's really what pushed me to major in biology when I was in college. A lot of like pre-med and pre-dental people do it just because of like the requirements and the classes, but I actually genuinely was really interested in it. And it was definitely one of the best decisions I ever made. And I don't think I would be where I am now if it wasn't for that passion, because it really kind of helps you to see things in a different way. And as far as going into dentistry specifically, I think that it was a really good fit for me just because I think dentistry takes like someone who's like a people person and who's very like kind of extroverted. I think extroverts definitely thrive in dentistry because you're kind of surrounded by people all day. You're seeing patients all day long. So it really is, I thought it was good for someone like me who likes being around people, who has, these hand skills that I like putting to use. So it just kind of like fell together perfectly. It was a perfect fit in that sense.
Awesome. You have to be able to talk when someone can't talk back to you.
Exactly.
Yeah, exactly.
All right. That's great. Thank you, Shada. Okay, so we're going to turn it over to our awesome students. They have a lot of great questions. We're going to turn the camera so you can see them all and their beautiful faces because they're so beautiful. I don't know if you guys can see them. Waving. It's kind of,
Sammy, can
maybe turn the light on, Sammy. Yeah.
Not the front one, the back. I mean,
And
yeah,
Shada,
the back.
Cameron's hiding in the back. I don't know if you can
Try
it.
Okay.
Okay, so Brendan's going to come up with the first question.
Your questions are right up here. You're going to read
Right here.
them.
I'm going to read the question. Please come up so they can see you and say hi.
Do you remember what your question was?
Okay. Hi, I'm Brendan, and we're not on count. Hold on.
Hi, my name is Brendan, and my question was, how did working throughout the pandemic like affect your job, and how did you deal with that? Because I bet it was like mentally draining.
Did you hear her? Okay. How did the pandemic affect your job? And if someone wants to jump in, I don't want to control the order if you feel like you really want to say something.
So yeah, for us, it was really difficult because we did not want 50 groups of pet owners in the hospital walking in and out, especially at the beginning, pre-vaccine and when things were rough. So what we did was we set up Zoom in each of the exam rooms. We had staff come out, grab the animals, come back inside, and we Zoom chatted with everyone so they could watch the appointment. It actually was helpful in some regards. We saw a lot of dogs who sometimes are aggressive, who actually were much easier to deal with. And we think it might be they were protecting their owners. And then when we separated them from their owners, they were much calmer and easier to work with. The downside was it's surprising how many people can't operate Zoom. You would send people out in the middle of the winter leaning into their car, trying to get their Zoom to work on their cell phone, which kind of eliminated any advantage of trying to separate us from them. But everything ended up working out well. It was really remarkable how many people adopted pets during COVID. I mean, they were clearing out the shelters. Everyone got new dogs, new cats. So we were extremely busy. Us and the emergency hospitals really did take a brunt of it as well, because all of the local animal hospitals were completely booked up, and then it spilled over. So it's actually changed the entire community, the entire veterinary community. Thankfully, there have been very few returns of these pets, it seems. Most people kept their dogs, became good pet owners, and everything's worked out. And now people are coming back in, and we're returning to normalcy.
Great, thank you. Anybody else want to pipe in about COVID?
So for us on the ambulance, a lot changed because we were often the first ones going. And I remember the first call I went to where it was suspected. It's scary because we didn't know what we were dealing with at the time. We were wearing full body gowns with like firefighter respirators to keep ourselves safe. And it was definitely scary. We got a lot of cool stuff for EMS out of it. We do a lot of community-based practices now, which are really important You know, at OVAC, we do community testing for COVID. We do community vaccinations, and there's just so much of a need for it. And there were times where we were seeing lines up to 400, 500 people in a day just coming to get tested because we were one of the only spots available to do it like free of cost for the community. So there were a lot of like scary parts, a lot of learning stuff, and a lot of cool stuff that came after, and a lot of increased opportunity for EMS as a whole. It's cool. It was scary, but it's cool now.
And OVAC was fantastic during this whole thing. You guys were great. Or
It was a long couple of years.
I'm sure.
Assany is very lucky to have OVAC.
As a nurse, COVID was rough to say the least, especially being in management. It literally was like one day it was COVID, or one day it was no COVID, and then the next day the entire hospital is full of COVID. So my manager and I actually voluntarily, I don't want to say stepped down as managers, but it was kind of like all hands on deck. So I went back to working nights. He went to work in the ICU, and it just was a really rough time. Staffing was up and down with staff members out, and it was very much scary. We had like one of the first patients in like the northern Westchester area that had COVID. So it was like, it was a scary time. And then PPE was tight. So like I had to be like the mask manager. People would like sign out masks, and then like the guidelines were constantly changing. So it was certainly a lot. I definitely learned a lot. Just about like what I can deal with, not only as a nurse, but as a nurse manager. I would say the toughest thing was the amount of loss we had, just like overwhelming. Like it got to the point where I'm sure you guys saw like the freezers outside of the hospitals because the morgues were just so tied up. It even got to the point where like the entire hospital ran out of body bags, and they're literally like my 10-hour shifts turned into 14, 15-hour shifts. But it certainly was a lot. But I'm happy that I made it out. I never got COVID.
Wow.
But it definitely was, there were some times where I'm like, dang, like I don't even, like this is not what I signed up for. And I compare it to kind of like the Army, but like the Army, like they rotate out. It's like,
Right.
I hate to be so like grotesque, but it's like one patient dies, you wrap them up, and it's on to the next, and you just try and keep the next one alive. And it was rough. We certainly are seeing like a decrease in numbers now, and we still have little outbreaks here and there, but it certainly isn't how it was, where it's to the point we're having ethics committee meetings about, do we give the ventilator to someone's 90-year-old grandma or the 35-year-old that's completely healthy? So it was rough, but I'm glad that we're getting back to normal.
That's amazing. It's amazing. Shada?
So I can't really top that, but I was still in school when the pandemic happened. So my experience was really similar to you guys. Like I was just like at home, like sad about school being closed. I was like asking my brother to teach me how to use TikTok. Like I was really just kind of like trying to finish the degree. We were closed for 6 months, so it definitely was like a really weird feeling. But going back to school was really great because there's all these people who hadn't seen the dentist for 6 months. So, you know, like everyone came with all these new aches and pains and all these problems, and being able to take care of that for them, you know, and getting to kind of see the look on their face when they're like, oh my God, this has been bothering me since March, and like I'm finally out of pain now, was a really rewarding feeling. I definitely think I got a lot of good experience unexpectedly, just because like, you know, as I can imagine with any other kind of clinic, our school was like booked like all like months out, you know, like I had to book patients like 3-4 months in advance because there were just so many people. So it definitely was an adjustment. There were a lot of hard days, a lot of exhausting days. There were some days where I would come home from school at like 8 o'clock and I would just like pass out. Like I wouldn't even be able to stay awake. But Yeah, I definitely learned a lot. There were a lot of changes to dentistry just because dentistry was definitely one of the more at-risk professions in terms of COVID because we use so many aerosols. So I think the profession as a whole kind of shifted. There were all these like new guidelines we had to keep up with. So it was definitely chaotic, but I think looking back now, it's definitely made it safer and a lot of good experience that I was definitely lucky to have.
Yeah, that's great. I like how you, in your bio, I like how you also talked about dentistry in terms of, you know, like you're getting people out of pain. I think a lot of times people think of the dentist as the one who causes pain. And so I really like that you know, how you think about it. I think that's probably the correct way that we should be thinking about it, right? So that's great. Okay, so Allie has a question for Joey.
Hi. Okay.
Hello.
Do I have to bend down? Okay. Okay. So what inspired you to become a paramedic, and did something happen in your life that influenced you to do this job?
So I did want to follow in Mr. Olson's footsteps. I don't know if anybody knows him anymore. He used to be the assistant principal when I was in school. He had a really big impact on my life. And it was cool to be able to, you know, do something that I ended up loving while also, you know, hopefully making him proud. And it just expanded from there, you know, working as an EMT. There's like that little bit of satisfaction where you are making a difference, even if it's just small. Being able to do more as a paramedic, you get to do a lot of crazy stuff in a tiny little ambulance. And it's really a lot of fun. Like it gets scary, it gets hectic, but you have a lot of fun. All of your coworkers are like family. We spend up to 24 hours in our station. We cook dinner together, watch movies. We do a lot of fun stuff. So it's been a really fun profession.
That's great. Thank you. Gabby has a question for Dr. Clinvard.
Hi.
What are the little signs behind you?
We can't see what it
is
says.
We're trying to figure it out.
Oh, it says, "Hi, Alexa," who's currently watching in algebra, I believe. Geometry, I apologize. Geometry.
My question is, what made you want to open your own practice, and what steps did you take to get to where you are now?
Okay, so I worked at 2 practices beforehand, and the truth is, you know, a lot of it is I want to be able to practice exactly as I want to practice, which as an owner versus an associate, you can really choose. But a lot of it is also money. You make more money owning a practice rather than working for someone else. So in a lot of these professions, you work for someone else, you really learn the ropes, you get used to everything, you build clientele, and then you open your own practice. To get here, it was difficult. I mean, there was a solid 6 months when I was doing a house call practice, driving around. Most of it a lot of it during the summer, however long summer is. So it was hot. You know, getting to someone's house, 20-minute drive, and then they can't find their cat was kind of frustrating. So we learned things like, please keep the cat in the bathroom until I get there. You know, we found out a lot of dogs are relatively aggressive when you get into their house, but they're not outside of the house. Building it, luckily my wife did a whole lot of that, probably most of the work actually building it, dealing with the you know, the building department, getting permits, working with contractors. I actually went to OHS with our contractor, Chris Gomes of Riverside Contracting, who helped us build this place out. Finding a building that would work, you know, it was along a major thoroughfare and had enough room to have multiple exam rooms and separate waiting room was also not that easy. There are only a couple of options in the Ossining area, and I wanted to stay local. Luckily, I already had, I knew a lot of the drug reps and distributors, so that part was pretty easy. You know, they just helped us figure out what to do on initial orders, what kind of drugs and equipment to do, built it out, and hit the ground running. Joined the Chamber of Commerce, went to the fairs downtown in June, what do you call
Village
it?
Fair.
The Village Fair, and luckily word of mouth spread quickly.
Is it hard to manage the business side of your own practice?
Well, I have the most overqualified office manager ever. My wife is an engineer, and she handles most of that. I really do most of just the business. I mean, most of just the medicine. So yeah, for her, it's a lot of work. And frequently she's still answering emails, putting together estimates, placing orders, that kind of stuff at 10, 11 at night. Luckily, she doesn't need sleep like a normal person, so it works out.
Awesome. You're very lucky.
Yes. This wouldn't have worked out otherwise.
Yes. Often I think it's a family affair, right?
Yep. Thus, family veterinary care.
Yes.
Hi, my name's Sierra, and my question's for Janae. By the way, I want to be a nurse, so it's fine. What can you explain exactly what you do on a day-to-day as a nurse manager?
Sure. So I'll explain two ways because my role kind of changed when I stepped into management. So when I was a staff nurse, so that's just more or less a regular nurse that cares directly for patients. I would come in at about 6:45 p.m. after sleeping all day because I worked nights. So my internal clock was completely backwards. I got my assignment of patients. I'd look them up. I would give report to the tech that I was working with that night. And then it was kind of like divide and conquer. At night, it's a little different. People think patients sleep at night in the hospital. They don't. People's grandmas and grandpas are like different people at night. So, a lot of giving medications, emergency situations, so cardiac arrest, or if a patient's in a funky heart rhythm, a lot of cool stuff. I personally like nights. You get paid extra, and I'm a type of person that doesn't require much sleep either. So now when I transition into management, I'd like to say my role as the assistant was half and half. So 50% clinical and 50% managerial. So I primarily oversaw the evening and night staff. So I would do performance evaluations. I'd make sure that the patients are satisfied, make sure that the staff are practicing appropriately, jumping in to help in emergency situations, dealing with unhappy patients or family members, which is definitely tough. Discipline, of course, which I never enjoyed doing, but it's a part of the job. And I would say the most fulfilling part of being a manager is seeing someone's professional growth and development. I kind of prided myself on being the open door manager. Office door was always open, very approachable, and was never afraid to get my hands dirty. So that's a little bit of the day in the life.
Awesome.
Thank you.
Thank you. Okay, you have to step in on the camera.
This is Ashley.
Hi, my name is Ashley. My question was for all of you, and it was, how do you stay informed with current healthcare advancements?
I didn't catch that.
It was, how do you stay informed with current healthcare advancements?
In veterinary medicine, we're required to do a lot of continuing education. So I'm sure actually everyone does. Forget the number. It's something it's not nearly as much as in a lot of the human field, but I want to say it's in the high 40 hours every 2 years. So during COVID, it's been a lot of actually basically like this. We're watching Zoom presentations and doing continuing ed. Hopefully, I'll be able to get away in November and do a hands-on week-long continuing ed conference, which is always fun. But generally, yeah, we all have to keep up and lecture. Usually, specialists run, sometimes industry people, and sometimes out of the industry, mental health people talking about burnout and other kind of stuff, which is always a big deal in the mental health field.
Yeah, just to piggyback off of that, continuing education credits. I'm actually, for one of my certifications, I have about 100 hours to complete my renewal by the end of May, and I'm moving, so I'm trying to do that. But yeah, definitely continuing education credits. I find just like talking to people, you learn a lot of different things. My best friend works as a labor and delivery nurse. I have no idea. I don't know anything maternity. She doesn't know anything cardiac. So we kind of like share stories and stuff. And I mean, I try not to watch the news as of late. It's just too much. So I would just say I personally stick to like my CEUs or just talking to other healthcare professionals.
Great.
Yeah, we're the same, but we get the unique experience where we get to talk to the nurses and the doctors that are in the hospital that we're going to, and they give us feedback on like how our call went, what we could have done different, and it's a cool, healthy relationship between all providers. It's we have a very close friendship with Phelps Hospital, so they do a lot of continuing education. Their doctors and nurses do a lot to help us. We're all one big team.
Yeah, as soon as, in addition to continuing education, as soon as you graduate from dental school, you get like 1,000 emails and like magazines every single day. I don't know how they find your contact information, but they find you. I'm a part of emails like lists that I don't even like know how I signed up for. So you literally can't get away from it, even if you want to. And on top of that, as far as dentistry goes, it's a very small community compared to medicine. So like people talk a lot more. You go to like all these conferences, even your own friends, like my friends will text me all the time with like x-rays and be like, what would you guys do here? So it's like a very like kind of like talkative profession in that sense. So in one way or another, almost every day you're constantly learning something new, either through like media or through your friends or like these classes that we are required to take.
Awesome. Thank you. So we only have like 3 minutes, but maybe each of you, if you could look back on your the high school versions of yourselves and, what advice would you give yourselves? In terms or nothing.
I mean, I don't know. I was like very type A in high school, and it certainly helped in college. I mean, you could be type A, but like still have fun and enjoy life, and just take each day a day at a time. And a lot of the stuff you worry about in high school, like, really doesn't matter after high school.
That's very good. Anybody else?
So I definitely didn't take high school as serious as I wish I would have. There are so many cool classes that you get to take in high school that you might not be able to take while you're trying to fill your curriculum requirements in college. Like this future healthcare leaders class is amazing, and I'm a huge supporter of what you guys are doing. There's so many different medical professions that are out there that you might not know of that now you get to experience. And then I'm sure there's other classes like that just you can experience what life is like outside of school and be able to take these risks and take classes before you can't, because when you get older it's harder to take the cool classes because you have to balance work, paying bills, and finishing whatever classes you have that you're taking. And I definitely wish that I'd explored more in high school in terms of classes, because there's so much.
And there is a whole lot more than when I graduated available now. I mean, we're looking at the class schedules. There's just so much you can take. So I think spending a good amount of time and really figuring out what you're interested in, like Joey said, taking advantage of what's offered. It's really great. I don't know if I wasn't paying attention or just there weren't that many classes in the 90s when I was there. But it's really impressive what's available now. And all these programs with the research and the healthcare and everything that you have. It's great what's going on.
That was actually just our bell. Shada, I don't know if you want to add something real quick.
I was just going to say the same exact thing. So they covered it.
Can you guys say thank you?
Thank you.
Thank you guys. A million thank yous. This was
This was great.
amazing.
Thank you so much,
for being
everyone.
here.
For having us.
So great to see you guys. Really.
Thank you. Thanks so much. And the sessions are all recorded, so we're gonna share them all out, and you can watch it again or share them. But thank you so much for the insights and the journey. And you may get some emails from students or teachers that are interested in finding out more information or suggestions. So hopefully you're okay with that. And thanks again.
Yes, Jeanette. And Jeanette, we might be calling all of you, by the way. you know, we're always looking for good
Presenters.
speakers. So, yeah, and we're not shy. So,
You want to say hi?
thank you. Do you want to say hi to Cameron? Shayna, he's here.
Yes.
You guys, thank you so much. That's and thank you, Barry and Jack, for organizing, and Allison.
Mr. Yonkler, Mr. Jacklis. Hey Yonkler, it's Lewis. I don't know if you can see me. I have.
Hi, Luis. How are you? What's up, Luis?
Hey, Mr. Jacklis, how you guys been? I'm Miss Doherty.
Hello, what's happening?
How are you?
Nice seeing you guys. It's nice hearing all your stories. Thank you guys for sharing on Alumni Day.
Yeah, what are you doing over there?
Me, slacking around,
You working with Dr. Clinvard?
No, I work at McDonald's actually. I just wanted to show up for the meeting.
Okay.
I'm just joking, Yonkler. You know me. Of course, I've been working with Dr. Clinvard for a few years now. Actually, started interning him in high school. So yeah.
Wow.
Nice, yeah. So it was nice seeing you guys. I heard your voice. I wanted to say hi.
That's so cool. Thanks, Luis.
Anytime. Take care, guys.
And
Wonderful day.
Dr. Root is hiding behind.
Doctor.
He's hiding.
We have a lot of OHS grads here.
I know you hire all of our students.
Yes.
We love that.
We love hiring OHS grads.
Janae?
There's
Hey.
another OHS.
Ryan, what's up? You're like a full-blown veterinarian now, right?
Exactly.
Wow.
Janae, you did surgery on my dog.
Get out. You let him touch your dog?
He was a chucklehead in high school, but he's a good surgeon now.
Wow, good for you, Ryan. Such a small world.
Amazing. Simply amazing.
Take care.
Makes me very proud. This whole thing just makes me very proud. You guys should be very proud of yourselves, and thank you so much for being here. You're awesome.
Yeah, I think the reach of our alumni network is really, really impressive. It's cool. As I was looking through the list of some people that I haven't spoken to in a while, there's so much. It's so cool.
Yeah.
Thank you, Joey.
Yeah, when I was at Northern, I hired a few OHS grads. Maria Saravia, she's a registered nurse now, but she worked on my unit. And we were in the interview, and I'm like, oh, we went to OHS together. After that, I was like, just give her a job.
That's right.
Hopefully this makes some more connections, right? That's kind of what we want our kids to see, that what's out there, and maybe make connections between the Ossining people.
Yeah. The next year I'll be on the beach for this session.
Okay.
All right, we got to run, but it's great to see you guys. Thank you again for everything.
Thank you,
Thanks,
guys.
guys.
Have a good
Thanks
day.
for hosting. Thanks for coming.
Yeah, Naomi, Katie, thank you. Thank you, guys were awesome.
Bye.
Bye.
All right. Thanks, everybody.
Thanks.
Thank you, guys.
Perfect. Over.